Good morning, my name is Cedric Chua, a third-year medical student from UCC. Today I will be conducting a lung examination on you, which will involve me taking a look at your face, hands and chest. Is that okay?
Yes.
Before we begin, can I have your name and date of birth, please?
My name is Malik Zidan. My date of birth is 23rd of May 1993.
And that would make you
24 years old.
Thank you, Malik. Could you please remove your shirt while I adjust your bed to a 45-degree angle for you? On general inspection, the patient looks well and comfortable, does not look to be sinus or in any form of distress. No accessory muscles of inspiration are being used. There are no O2 lines, inhalers, or sputum marks and pods present as well. No stridor and wheezers are heard. May I look at your hands, please?
Sure.
There are no signs of tar staining. Capillary refill is less than 3 seconds, and there are no signs of peripheral cyanosis. There is no finger clubbing present. Do you have any pain in your wrists?
No.
Is it alright if I press on it?
Sure.
Do let me know if it hurts.
Okay.
Thank you. On the palmar side, there is no pallor in the creases and no signs of muscle wasting. Could I get you to stick your hands out like that for me? And spread your fingers out. You can close your eyes. Ideally, I would wait for 30 seconds, but due to time constraint, I will wait for 5 seconds instead. There is no presence of asterixis. I will now take your pulse. Do you have any pain in your arm?
No.
The pulse rate is of 64 beats per minute with normal rhythm. There is no presence of a bounding pulse, and the respiratory rate is of 13 breaths per minute. I will offer to take blood pressure, however, due to time constraint, I will move on. Could you look up for me, please? Can I pull down your eyelids?
Sure.
There are no signs of conjunctival pallor, ptosis, or meiosis. Could you look up for me for a minute? There are no nasal polyps, enlarged nasal turbinates, or deviated nasal septum. Do you have pain in your face?
No.
I'm going to press on your face. Do let me know if it hurts. There are no signs of sinus tenderness and no signs of plethora. There's no pursing of lips. Could you say E for me, please?
E.
Thank you. There's no hoarseness of voice. Could you open your mouth for me, please? There's no reddened pharynx or signs of tonsillitis. There is good dentition and no signs of dental caries. Could you lift up your tongue for me, please? There are no signs of central cyanosis. Thank you. Looking at the neck, there are no signs of collar of Stokes. Malik, could you please look to your left and downwards, please? JVP is not raised and is less than 3 centimeters from 0 point. Is your tummy painful?
No.
Would it be okay if I press on it?
Sure.
There is no sustained rise of JVP. Thank you. I'm going to be pressing on your windpipe. It might be a little uncomfortable. Would that be okay?
Yes.
There's no displacement. I'm going to be pressing on your windpipe. It might be a little uncomfortable. Would that be okay? Yes. There's no displacement of the trachea felt. And cricosternal distance is normal. Could I get you to take a deep breath in, please? There is no presence of tracheal tug. Malik, could I get you to sit up with your hands on your hips, please? There are no thoracoplasty or thoracostomy scars. No presence of a barrel-shaped chest, pectus excavatum, pectus carinatum, hericans sulcus, or indrawing of the intercostal muscles. Looking at the back, there's no kyphoscoliosis or lobectomy scars seen. Could I now get you to swing your legs to the side of the bed? I'm going to need you to take a deep breath in and out and hold. I'll take a deep breath in. Okay, thank you. And again, a deep breath in, out, and hold, and a deep breath in again. Thank you. Hoover sign is negative. I'm now going to check the lymph nodes. Submental, submandibular, preauricular, postauricular, occipital, posterior triangle, anterior triangle. Could you shrug your shoulders for me, please? Supraclavicular node. Could I get you to give yourself a hug, please? Normal resonant sounds are heard on percussion. I'm going to listen to your lungs now. Will you please take a deep breath in and out through your mouth when you feel the stethoscope on your back? Normal vesicular breath sounds are heard without crackles, wheezing, or stridor. Could you also say 99 every time you feel the stethoscope on your back?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Normal muffled sounds are heard. Thank you. You can lie back on the bed now. Alright, we're going to do the same as before. Could you take a deep breath in and out and hold? Now take a deep breath in and out. Thank you. Once again, breathe in and out and hold and in again. Thank you. Hoover's sign is negative. I will now feel for your apex beat. Second intercostal space, third, fourth, and fifth. The apex beat is found on the fifth intercostal space at the mid-clavicular line. There's no displacement of the apex beat. I will now percuss the chest. Normal resonant sounds are heard. Now listening to your lungs, please take a deep breath in and out through your mouth when you feel my stethoscope on your chest at your own pace. Thank you. Normal vesicular breath sounds are heard without crackles, wheezing, or stridor. Can you lean forward for me for a moment? There are no signs of sacral edema. Thank you. And no pitting edema in the legs as well. I've concluded a normal respiratory examination. Thank you so much for your time, Malik. You can put your shirt back on. I've just concluded a normal respiratory examination on Malik Zidane, a 24-year-old male. On general inspection, there are no peripheral signs of respiratory diseases. On chest inspection, there are no scars or deformities seen. On palpation, symmetrical bilateral expansion of lungs are observed, and on chest percussion, normal resonant notes are heard on all lung fields. On chest auscultation, normal breath sounds are heard with no added sounds like wheezing, stridor, or crackles. Vocal resonance produce a normal muffled sound quality. To follow up with this patient, I would recommend doing lung function tests such as spirometry and peak flow, as well as a chest X-ray. Thank you.